Bonnie. Bonnie Bell and I have been literally best friends for 17 years.
I'm sorry, after all this.
But obviously, you know, when I spotted the signs or the signs of early onset Alzheimer's, the relationship shifted.
I'm fine.
You're all right now? Basically, yes, I'm the full-time unpaid carer, which I'm happy to be. I see it as a privilege.
One thing, it's another, huh? Somewhere near you, there'll be people like Dave and Bonnie, a carer and cared for, a husband and wife, a daughter and mum, a brother and sister, or, as in Dave and Bonnie, best friends. Someone with dementia being helped by someone without. Do you have any family, Bonnie? Do you have any family?
Yes, I've got a son.
Have you? How old is he?
He's
It's tough at the best of times and has been made much worse by lockdown and the restrictions that go with it.
So I lost everything and she lost everything, and we were kind of, you know, locked together. But there have been some moments of, you know, well, feelings of despair, and they're not typical for me. But yeah, that's been real.
What does it feel like getting close? Because I think most people won't know it because they've never been in that situation.
It feels like you're looking down a dark hole. It feels like whatever you do to make things better can only make things a little better for a short period of time, and it concentrates the mind on the fact that this is a losing battle, and it's tough fighting a losing battle. That's how it feels.
Dave is hardly alone. Newsnight has exclusively seen research which lays bare the extent of the dementia care problem across the UK. 95% of family carers surveyed said that the extra caring hours they've had to put in during the pandemic had impacted upon their physical or mental health. 69% said they'd felt constantly exhausted, 64% felt anxious, 49% depressed, and perhaps that's no surprise when you consider that half said they were putting in more than 100 hours a week in care, and that 83% said that the health of those they care for had nonetheless deteriorated during the pandemic. Newsnight reported on the extent of the impact on dementia in the spring, when nearly a third of COVID deaths were made up of those with the disease. At the time, the Alzheimer's Society was calling for government to put dementia at the centre of its strategy to prevent it all happening again as summer turned to winter. They don't believe it's happened.
Well, we know that some issues for people with dementia, such as visiting in care homes, is still not sorted out. You know, the testing isn't there. We're still calling on the government to recognise just one key family member as a kind of key worker for each person in residential care. With the testing and PPE, they need to be able to offer that really good quality as an equal partner in care. That's absolutely vital to people living in care homes, which is still not resolved, you know, 6 months in. But we're also calling on the government to ensure people who have had social care support removed have it returned as soon as possible, as soon as it's safe to do so, which means getting PPE and testing right for people with that are delivering domiciliary care.
Getting her out of bed, I could shower.
Gordon looks after his wife Sue, who has advanced dementia. He himself has cancer.
It's brought our life really to a stop. It's difficult at times.
He's dreading further restrictions should they come.
Yes, it has. I, had no life. My life was just looking after my wife. So, it's very depressing. You can't socialise. You can't see anybody. You can speak on the telephone, but it's not the same. So, it has had a profound effect on me. But I'm going to try and get over that now and get myself back. Now I've got some time to socialise. And of course, the worry now is that we get locked down again, and that would be very, very difficult.
There's no doubt that those with dementia and those who care for them have borne a terrible cost during this pandemic. But as we head into winter, it could get tougher still. In the spring, many of the charities which plug the gaps left in our deeply uneven social care sector were still in reasonably robust health. Today, after a year of financial battering, many are closing services on the brink, and therefore those precious hours of respite for cared for and carer alike are in jeopardy. The prospect and experience of being a carer in the second wave could be even worse. Dave at least has his music, his live performances finally resuming. He fears, as restrictions return, that they'll disappear, along with any limited help for Bonnie, which has reappeared with them. There's much talk of more blanket restrictions to come. Perhaps when they're being made, we ought not to forget, and perhaps make exceptions for those around us who forget all too often.